The future of healthcare, it isn't some distant sci-fi fantasy anymore. It feels like it's unfolding right now, almost faster than we can keep track.
It really is moving quickly.
So today we're doing a deep dive. We've got a stack of sources here that give us a pretty clear look, actually, at the top 10 groundbreaking healthcare and medical tech trends we should expect to see really taking center stage by 2025.
Yeah, and this isn't just guesswork.
No, exactly. It's stuff that's already in motion.
And our goal here, really, for this deep dive is to help you cut through all that noise, all the information overload. We want to highlight what's genuinely important, what's impactful, and maybe spark a few of those aha moments about this medical landscape that's, well, forming around us so fast.
Yeah, get some clarity.
Right, because these are just ideas floating around. These are innovations moving pretty swiftly from the lab bench into, practical use, often in less than, say, 2 years.
Okay, sounds good. Let's kick things off then. First up is a concept that feels like it's genuinely redefining health. Practical longevity takes center stage. Now, when you hear longevity, I think most people just think, okay, living longer, adding more years.
Right, the simple extension.
But these sources, they seem to be pointing towards something, well, deeper.
Yeah, much deeper. What's truly revolutionary here, I think, is that practical longevity, it isn't just about adding years to your life. It's about optimizing health span.
Health span, okay.
Exactly. We're talking about a real paradigm shift.
Yeah.
Moving away from just reacting to sickness towards a proactive, predictive model of health.
How does that work in practice?
Well, it involves highly personalized strategies. Think advanced medical screenings, digital health tools, often leveraging generative AI, all creating these data-driven roadmaps for maximizing your performance, your wellness throughout your entire life.
Right.
You see figures like Brian Johnson or Eric Topol really pushing the boundaries here, showing what's possible.
So, okay, it's not just living longer, but living better, living healthier for as many of those years as possible.
Precisely.
And for you listening, this really means getting the tools, the insights, to become a much more active, informed player in your own health journey, moving beyond just, reacting when something goes wrong.
And taking control.
Taking control, exactly. Now, that proactive role, it sounds like it needs a lot of data, a lot of smart systems working behind the scenes.
Absolutely. Data is key.
And speaking of efficiency and leveraging tech, our next trend really tackles a huge pain point for doctors. I mean, the burden of admin tasks. It impacts patient care too, right?
Oh, absolutely. It's a massive issue. Doctors right now spend just an enormous amount of time on documentation, charting, clicking boxes.
Staring at the screen instead of the patient.
Exactly. It creates this screen barrier. And that's where AI scribes are set to make a huge difference. Not just saving time, but maybe fundamentally rehumanizing that doctor-patient interaction.
Okay, so how are they different from just like voice dictation?
Yeah, good question. They're way more advanced than simple voice-to-text. These AI scribes understand the context, the nuances of a medical conversation. And they can seamlessly convert that whole discussion into an accurate, compliant medical record automatically.
Wow. Okay, that's a powerful vision then. Your doctor's spending less time typing, clicking, and more time actually focusing on you, talking with you. It really shifts the dynamic, doesn't it?
Completely. For you, the listener, it means a better, more present conversation with your doctor. And for the doctors, a huge boost in efficiency and, honestly, probably job satisfaction too. Less burnout.
Yeah, I can definitely see that. Okay, so if AI can free up doctors for more human connection, let's talk about a class of medications that has already had just a seismic impact on health. GLP-1 agonists.
Right. Ozempic, Wegovy, those kinds of drugs.
Exactly. For weight loss, diabetes management. Now, a lot of people, I think, might see these as some kind of magic bullet.
That's a common take.
What's the biggest misconception there? And how does this digital health integration piece really change that whole story?
Yeah, that's a really insightful question. The misconception is often that the drug alone is the whole answer.
Right.
Look, GLP-1 agonists work wonders. They mimic a natural hormone, help regulate appetite, blood sugar.
Right.
It's a fundamental shift in treating these complex conditions, no doubt. But their true long-term effectiveness, it really relies heavily on integrating them with digital health technologies, tools that support the crucial lifestyle changes that still need to happen.
Okay, like what kind of tools?
We're talking apps, platforms that provide structured calorie reduction plans, maybe tailored exercise programs, ongoing behavioral support, coaching.
Got it. So the medication kind of opens the door,
Exactly.
but the digital tech helps make sure you actually walk through it effectively and, stay on track.
Precisely. It makes these treatments part of a bigger, holistic, integrated health strategy. It's really a necessary partnership between the pharma companies and the digital health companies.
That makes a lot of sense. It's the whole package.
It has to be.
Okay. And our next trend, it sort of builds on this idea of personalized health insights, but maybe even for people who wouldn't expect they need it. Continuous glucose monitors, CGMs, potentially for everyone.
Right. This is fascinating. CGMs have been, you know, absolutely indispensable for people with diabetes. Real-time, critical data.
Life-changing, yeah.
Definitely. But what our sources are highlighting now is their expanding use case. For individuals without diabetes,
Okay.
these little unobtrusive devices can offer incredibly valuable continuous insights into how specific foods, your sleep patterns, different activities, how they all affect your blood sugar levels moment to moment.
Huh. And why does that matter for someone without diabetes?
Well, those fluctuations, even within the quote-unquote normal range, can dramatically impact things like your mental clarity, your energy levels, even your daily productivity. Mood, too.
Wow, so no more guessing games about whether that supposedly healthy smoothie is secretly sending your blood sugar on a roller coaster.
Kind of. It's about using very precise personal data to figure out what truly optimizes your specific body's performance and well-being, moving beyond that one-size-fits-all dietary advice.
Personalized nutrition based on real-time feedback? Very cool.
Very cool and potentially very impactful for general wellness.
Okay, so if CGMs are giving us these super detailed insights on the individual level, let's maybe zoom out a bit to the broader revolution happening across healthcare. And that's, well, the huge wave of generative AI.
Ah, yes, Gen AI, it's everywhere.
It really is.
Yeah.
What's the scale we're talking about in healthcare specifically?
It's already significant. We're talking about systems that don't just analyze data. They can create new things, text, images, summaries, even potentially helping design new drug compounds.
Right.
The scale. There are already over 1,000 FDA-approved AI-based technologies in healthcare. Over 1,000.
1,000.
Yeah. And what's really going to accelerate things, according to the sources, is the emergence of marketplaces for these generative AI applications.
Marketplaces, like an app store for medical AI.
Sort of, yeah. It means physicians, hospitals, they won't necessarily need to build their own complex AI models from the ground up. They can find and implement powerful, pre-built, maybe even specialized tools much more easily.
Okay, so that drives efficiency, speeds up innovation.
Massively. It makes these advanced AI capabilities way more accessible to providers everywhere, not just in huge research institutions or tech labs.
That's a definite game changer for getting these tools actually used.
Absolutely. Spreading the benefits.
But okay, that accessibility for providers is huge. What about accessibility for everyone else? Especially, in places with limited internet or maybe less powerful devices? That brings us, I think, to small language models, or SLMs.
Yes, SLMs. This tackles a really critical point about equity, about global access to these advanced tools.
Because the big models, the LLMs, they need a lot of power, right?
Exactly. Large language models often demand significant computing resources and, crucially, a constant, stable internet connection. That's just not the reality for billions of people around the world.
Right.
Small language models, SLMs, are designed differently. They're built to be far more efficient. The key thing, they can run effectively on standard devices, like a basic smartphone.
Okay.
Even without an active internet connection.
Really? Offline AI help?
Potentially, yes. And what's remarkable here is the implication.
Mm-hmm.
This could genuinely make useful generative AI tools accessible to billions more people globally.
Wow.
It's about democratizing access to advanced healthcare insights, basic support, information, reaching populations that have often been left behind by tech waves.
That's a really profound potential impact, truly global reach.
Mm-hmm.
Okay, this whole landscape, it just feels like it's moving at lightning speed. So much change.
It is.
And that brings us to a trend called futures methods go mainstream. Now that sounds maybe a bit academic. What are futures methods in a healthcare context? Why now?
Yeah, the name sounds a bit abstract, but its application is very practical, actually. It's not about gazing into a crystal ball. It's about adopting established, pretty rigorous approaches for doing evidence-based prediction and strategic planning, specifically within the therapeutic and medical fields.
So like formal ways to look ahead?
Exactly. Think of tools like structured scenario planning, horizon scanning. It's about using systematic methods to analyze potential futures, assess risks, identify opportunities, making sure that healthcare innovations, the ones we pursue, are grounded in solid analysis of where things are heading and what the future needs might be.
Rather than just reacting or, chasing the latest shiny object.
Precisely. It brings a much more strategic, less purely speculative approach to healthcare innovation. It ensures new ideas have a more robust, data-driven foundation before they even get off the ground.
That sounds like a really crucial anchor, actually, especially when everything is changing so fast. Provides some stability.
It does, a more thoughtful approach to progress.
Okay, and speaking of things getting off the ground, let's pivot to something many of us literally have on us right now. Wearables, watches, rings.
The quantified self.
Right, but they're also evolving, apparently, way beyond just counting steps or tracking sleep.
Oh, definitely.
Yeah.
The evolution here is moving wearables from just passive data collection devices
Right, tracking things.
to becoming active intervention tools. Companies are rapidly developing AI-powered wearables that are designed to function as essentially digital therapeutic devices.
Digital therapeutics, so they do something.
Exactly. They don't just passively log your heart rate or sleep stages. They can actively deliver personalized interventions based on your real-time data.
Like what?
Like guided breathing exercises if it detects rising stress levels, maybe smart reminders for taking medication, perhaps even nudges towards healthier behaviors based on your patterns.
So it's like your own device becomes an active partner in managing your health, maybe even intervening, not just a tracker anymore.
That's the idea. A profound shift in how we think about and use personal health tech. Much more proactive.
Very interesting. And that idea of tech as an active partner leads us straight into the next point. AI actually joining the medical team, working directly alongside patients and doctors.
Yes.
Yep.
This isn't just AI crunching big data sets in the background anymore.
Right.
This is about AI becoming a more visible, integrated part of the actual patient care pathway.
Can you give us an example of what that looks like?
Sure. A really concrete and, I think, impactful example is the rise of AI-based skin checking applications.
Okay.
These tools can help dermatologists. They allow patients, perhaps with a history of skin cancer or suspicious moles, to monitor specific lesions at home, maybe taking regular photos with their phone.
Right. Between appointments?
Exactly. Between those in-person visits.
Yeah.
The AI can help analyze changes, flag potential concerns early for the dermatologist to review, and essentially provide more continuous proactive monitoring.
So again, it's not about the AI replacing the doctor,
Not at all.
but it's augmenting their capabilities, extending their reach, and providing more seamless, maybe more timely care for you, the patient.
Precisely. It's about teamwork, integrating AI smartly into the care process to improve outcomes, extending the reach of expert care, really.
Okay. Lots of incredible potential here, but there's always a but, isn't there?
Usually is.
With all this exciting innovation, we also need to talk about the flip side. The very real challenges, especially for expensive hardware solutions, to actually get widely adopted.
Yeah, that's a critical reality check. We see incredible innovations. Things like advanced 3D printing for customized prosthetics or implants, sophisticated robotic exoskeletons helping people walk again after injury, immersive VR being used in physical therapy or even pain management.
Amazing technologies.
Truly amazing potential.
Yeah.
Despite how groundbreaking they are, the high upfront costs, often the complexity of integrating them into existing workflows, these pose significant barriers to widespread use.
So the tech might exist, but getting it to everyone is another story.
Yeah. Exactly. For these kinds of hardware-intensive technologies to really scale, to become truly accessible beyond niche applications or wealthy markets, the companies behind them have to find innovative ways to drastically reduce the cost and simplify how they're implemented.
It's a really powerful reminder, isn't it, that just because a technology is groundbreaking doesn't mean it's equally accessible from day one. Cost, complexity.
Yeah.
These are still major hurdles for achieving universal benefit.
Absolutely. It's definitely something we need to keep watching as these trends continue to develop. Who gets access? That's key.
Wow. Okay. We have really covered a huge amount of ground today, a significant landscape of change. From these super personalized like CGMs and longevity strategies, all the way to systemic shifts with AI, data analysis, even how we plan for the future of medicine. It really feels like 2025 is shaping up to be a truly pivotal year for healthcare.
I agree. It feels like an inflection point.
Transforming everything, really. Prevention, diagnosis, treatment, access.
It truly is. And what's really compelling, I think, is if you connect the dots between these individual trends,
Yeah.
you see the bigger picture emerge.
Yeah. What's the takeaway there?
Well, it's not just a list of cool new gadgets or software. It points towards a fundamental shift in how health and care are actually delivered. We're moving towards a system that's potentially much more personalized, definitely more proactive, and far more interconnected for everyone involved.
A whole new ecosystem.
In a way, yes.
Mm.
But this also raises a really important, maybe provocative question for all of us, for you listening as we look ahead.
Okay.
With all these incredibly powerful technologies coming online, these amazing advancements in health, longevity,
Yeah.
how do we make sure that they become truly accessible to everyone?
Why? Not just the wealthy or the well-connected.
Exactly. How do we avoid creating an even bigger gap between the health haves and have-nots?
Mm-hmm.
Ensuring equitable access.
Mm-hmm.
That's a massive challenge, and it's one we'll all need to be watching very, very closely as these amazing innovations continue to unfold.
A crucial question indeed, something for us all to think about.